Namaskar dosto. Welcome to channel Toxicology on Board. Today in this video we will be discussing another topic, DABT topic, reticulocytes. So let's directly dive into the question. So the question is reticulocytosis following high therapeutic daily dose of a drug is most characteristic of what response? So we need to understand in this question about the reticulocytosis and highly therapeutic daily dose of a drug is a characteristic response of what? So let's see what are the options we have. We have option A drug-induced normal physiologic response. Option B is drug-induced red blood cell destruction. Option C is drug-induced polycythemia. And option D is drug-induced aplastic anemia. See, with respect to this question, what I will suggest you to is read about the erythroblastosis, that flow diagram is there, no? How the RBC are formed, that particular different stages of RBC formation is there, that you read it. And also you read about different types of anemias. Different types of anemias are listed under, I think it is there in the blood toxicity, target organ blood toxicity will be given in the Clayson. You read about different sideroblastic anemia is there, hemoblastic anemia is there, aplastic anemia is there, puroplastic pure cell anemia something is there. So different types of anemias are there, and different types of drugs are there which are responsible for causing this type of anemia. So make a list, no need of making a list also. You already have in the Clayson, some tables are already given. Some of the tables I have mentioned in my video also. So go through that and see. So let's see what is the answer for this one. So the answer will be in green text, that is option B, drug-induced red blood cell destruction. So this explanation is given by the American Board of Toxicology. The question is taken from their website only. So let's see what is the explanation and reference given by the ABT. In case of drug-induced red cell destruction, reticulocyte count can be useful in the diagnosis. So whenever there is a RBC destruction is there, your erythrocytes are there. Destruction in the sense they are die. So now, so their count, the count of those reticulocytes can be used as a diagnosis, or that can be used as a tool to diagnose certain disease, certain conditions. Okay, because increased destruction is usually accompanied by an increase in the reticulocytes, young erythrocytes into the circulation. So in the case of blood vessels flow of blood, you can find the increase in contents of this reticulocytes, or you can say young erythrocytes. So you can count those things based on which can be considered as a diagnostic tool to identify certain disease conditions. So that is the question they are asking. That is the answer for this one. Let us understand why the other three options are also not correct for this respective question, and also we let us understand what is the further explanation given by the ABT, and also let us understand different types of anemia through this video. So in case of drug-induced red cell, this one we have seen, reticulocytosis would not be considered normal drug response. Okay, if you give a certain drug, generally reticulocytosis should not happen. If such thing is happening, then that is a trigger point. Okay, and polycythemia would be expected to decrease the production of new red cells. So if you look into polycythemia, this is the condition in which the new RBC production will be decreased. In the case of aplastic anemia, the bone marrow, whatever the bone marrow is there, no, would be unable to make a response. Hence, reticulocytosis would not appear. So, in the case of aplastic anemia, this characteristic condition won't be there. In the case of polycythemia, also that particular characteristic conditions, reticulocytosis condition will not be there. Okay, so let's see. So for this, if you want to read in detail more, please go back and check Casseret and Dole 9th edition, page number 496 to 598. Mostly this is consisting of blood toxicity के बारे में है. So let's go from this. What else we can understand about this particular concept? So some of you might still be having little confusion. What is? Let's see a proper definition. What is reticulocytosis? Reticulocytosis, it is an elevated number of immature red blood cells. So there will be increase in the RBC cells. In the blood, we have RBC, WBC, platelets. RBC number will be increased. Okay. And that too immature one, young one. Okay, called reticulocytes in the blood, which typically indicate bone marrow is actively responding to an increased need for red blood cell. It means that our body needs more number of RBC. Why? To carry more amount of oxygen. Wherever which part of our body which needs more oxygen, maybe cardiac or CNS like that. So at that time, our bone marrow should produce more number of RBCs. So whenever there is an increase in this reticulocyte, it indicates that bone marrow is actively responding to an increased need for RBC cells in our body. Okay, this condition can result from active red blood cell regeneration, right? Such as after blood loss. If there is an accident and there is continuous loss of blood from that particular injured region, then what you have, your bone marrow has to get activated. It has to produce more number of RBCs in order to meet the oxygen carrying capacity or need of this particular loss of overcome the loss of blood. Okay, or from certain types of anemia, there are certain disease conditions as well, sideroblastic anemia or aplastic anemia. So in those conditions also, where red blood cells are destroyed too quickly, generally there will be half-life span for erythrocyte will be there. Before that only, if immediately they are dying, in that conditions also, your bone marrow has to produce more number of RBC for the bone marrow to replace them, such as hemolytic anemia. The disease condition what I was mentioning is here, hemolytic anemia. A reticulocyte count is often used to assess bone marrow health and effectiveness of the treatment for anemia. If you are using certain drug for the treatment of a certain type of anemia, whether that drug is working or not, for that also diagnostic tool will be to count the reticulocytes. One, and another thing is that it is also used to check whether our bone marrow is functioning or not properly. Is it able to produce enough number of RBC or not? Because RBCs are very, very important to carry the oxygen carrying blood will be there, not to region, either in the heart or CNS like that. So what it is, again we have to understand, elevated count reticulocytosis is higher than normal number of reticulocytes, which are immature red blood cells in the circulation. And what is the sign of response? It signifies that bone marrow is increasing its production of red blood cells. And the process is called erythropoiesis. I told you, please read about different stages of the RBC formation will be there. This accelerated production is triggered by hormone erythropoietin. So whenever such a need is there, doctors what they do, they give erythropoietin injection, which is released when tissue needs more oxygen. As I said, RBCs are important to carry the oxygen to the desired part of our body. Okay, so what does it indicate? Reticulocytosis, this characteristic phenomena indicates what? It can show, it indicates active regeneration. It can show that body is actively replacing lost red blood cells, which is common after new or ongoing bleeding from an injury or surgery. Whenever there are practitioner surgical, a doctor is doing performing a surgery, or there is an accident, injury is there, the loss of blood is there. So in that set cases, body is actively replacing the lost red blood cells. Number two is certain type of anemia. As I said, different types of anemia. It is a key indicator. It is as a diagnostic tool also. Conditions where red blood cells are destroyed faster than they can be replaced. Hemolytic anemia or new blood regeneration in the case of fetus or newborn, right? So in case of pregnant women. Then next option, next important thing, reticulocytosis, when it indicates successful bone marrow function. In many cases, a high reticulocyte count is a positive sign. If there is an increase in reticulocytes, it means it's good. Your bone marrow is working good. It is producing more number of RBC. Then the bone marrow is respondingly effective to an anemic state. Okay, why it is measured? Two purposes. As I said, for diagnosing, and second one is for monitoring. What is diagnosis? Reticulocyte count is, it is a tool to help diagnose and manage anemia. If a certain individual, certain patient is an anemia, whether the drug is working properly or not, for that you can use it as a tool, and it also helps to diagnose. If there is an increase or there is an increase in reticulocyte, you can identify the disease condition of that particular patient and other conditions affecting the red blood cell production. Okay, and monitoring treatment, it is used to monitor how well treatments for anemia work or anemia are working. So from this video, hope you have understood about reticulocytes, reticulocytosis. There will be another video upcoming where you can see, where I have listed out the types of anemia. Okay, aplastic anemia, puroplastic anemia, pure cell anemia, like that. So there will be another video. Do not worry. But this video was restricted to particularly reticulocytosis. Okay, so try to understand that one. And read that particular blood toxicity, blood as a target organ. Read in detail. Okay, any question with respect to that one, you should be able to answer in your exam. Okay, thank you so much. Be curious. For any questions, please write a mail to arya.priyanka18@gmail.com. Like, subscribe, and follow my YouTube channel Toxicology on Board.